Morning. You're on Messy in the Middle with Jeannie. I am middle-aged, middle-income, middle America, and I am putting together videos that will hopefully help people to feel like they're not the only one doing the things they're doing. And sometimes when you're in a life, you're living a life, you find people that are become your tribe, they call it now, that are you can really identify with, but sometimes even then they don't truly understand what you're going through. And I have felt that a multitude of times in my life. So I felt like if I could put together some videos that would maybe speak to someone else and let them know that there is someone else out in the world that is dealing with or has dealt with some of the things that they're going through, that and still came out on the other side, that that might be helpful. So here we are. I am currently making apple butter. I was gifted apples by my aunt and uncle. They have access to an apple tree. His mom's house, there's a couple of apple trees. So there are tons and tons of apples that need something done with them, and I love to make apple butter, so I decided that that's what I was going to do today with these apples. So I am currently in my own kitchen, and I am making apple butter with these little baby apples. They're super cute, and they're very sweet and delicious, so I'm excited to make them into apple butter. Today I'm going to talk about my son. One of the big reasons that I wanted to do this channel is because of the trials and tribulations that we went through with our son, and some of the extreme things and some of the not so extreme things, the joyful, happy things that were just the day-to-day that we experienced when we had him. And the anniversary of his passing was last week. Oh, see, my slicer is not working right now. The anniversary of his passing was last week, and we went to dinner to mark the occasion. And while we were there, we decided to celebrate by buying the entire restaurant of workers. We didn't buy it for the other patrons, but for the workers. We bought them all a round of beer so they could celebrate with us. So it was a fun kind of different thing that we did, and I'm gonna have to do that one by hand, I guess. Different thing that we did, and we really enjoy that, finding ways to celebrate with other people, even when they don't know what we're celebrating. We, of course, didn't go into detail about what we were celebrating, but we were just celebrating, and we wanted to include the people around us. So we did that. We were in North Dakota with our middle daughter and visiting her, and we had a really neat place to go to dinner. It's called Dock Holidays. If you've never been to one, I don't know if there's even more than one, but we were in Williston, North Dakota, and we were visiting, and they have this really cool restaurant, and I would highly recommend. They have really good food. I would highly recommend going if you're ever in that area. And that is a ridiculous plug. They have no indication that I would be letting you know about that or advertising for them, so that is not a prearranged plug. That is just me saying we had a really good time, and it was a fun day for us, even with the history of the day. So Isaac was his name, is his name. He, depending on how you believe. Well, I am just having the most difficulty today with my slicer. My handle just came off. I am going to grab a screwdriver. I'll be right back. Okay, so I know that that probably seemed very staged, that I was just able to like jaunt off and grab a screwdriver, but I happen to have my toolbox sitting open over there because I got my hammer out the other day so that I could put in some nails to hang. I'm cleaning my basement and I needed to put in some nails to hang some things down there. And so I absolutely just had it sitting here. So that's odd. And like I said, probably looked very staged, but it is not. It's just me. And I'm just going to set it over here on the counter. So there could be a chance here later on that I need it for something else and I'll be looking for it and I won't be able to find it because I set it on the counter because I was doing a video. I'm going to wash my hands. All right. So back to Isaac. Isaac was the product of my first marriage. We lived in Hawaii at the time. My ex-husband was in the Army. We lived in Hawaii at the time, and I had had my tubes tied after my oldest daughter was born because at the time I was a single mom and I did not want to take the chance of having another child with no help, which was interesting because I had a lot of help. My family was really great and they were really supportive and lovely. And so I am not sure. When you're young, you have these thoughts that get in your head that you just, nobody can talk you out of, no matter what. And you really just you just decide that that's what you want or how you want to do something and you just do it. So my tubal after my first pregnancy was one of those things. And the doctor allowed it because I had good reasons for what I wanted. But I would say that typically a doctor would not allow that. And I appreciate that he did because it gave me peace of mind that I would not bring another child into the world unless I really was ready for that. And you can say all you want about, well, you know, keep your legs together, girl, and then you don't have to worry about that. But I was in my 20s and I was very comfortable with who I was, and I wouldn't say I was a slut by any stretch of the imagination, but I definitely wasn't afraid to be with somebody. So there's more to that story later, we'll talk about later. And I had my tubal, then I got married, and my husband and I decided that we wanted to have children with each other. And so he had a child before we were together, and I also had a child before we were together. We decided that we would like to have children together. So I had my tubal reversed, and they told me that there was a 50% chance that I would ever conceive, and if I did, it would probably be an ectopic pregnancy, tubal pregnancy. And so I wasn't 100% certain what would happen. But as soon as we were able to start trying, because of course there's a waiting period after you have a surgery like that, they don't want you to just go right away and start trying for children. But as soon as the month was over and we were allowed to start trying, we did, because of course that was the goal. So we were trying, and right away, I was pregnant with Isaac. Isaac was a very normal pregnancy. I would say very typical pregnancy. I lost a lot of weight that I had gained from my first pregnancy and never lost because he was a big baby, and I felt like he just kind of consumed me. And so all of that excess that I had left over, which was great because I was still a little heavy from the first pregnancy. And so they tested me for diabetes because he was so big, and they thought maybe that was a problem. And so I went through that 3-hour test. If any of you have been through that, you know that is not super fun. Drinking all of that sugary nonsense was ridiculous. And so I went through that 3-hour test because they had concerns, and turns out not diabetic and no gestational diabetes for me. And so my pregnancy was fairly normal, and I didn't have any issues while I was pregnant. I did develop shingles while I was pregnant, but I don't think that really had anything to do with the pregnancy. And so then it just happened to be where I was at the time, and happened to develop shingles. I had chicken pox as a child, and that was back in the day when your kid would get chicken pox and you would send them over. All the kids in the neighborhood would want to come play so they could get chicken pox and just get it done with, right? So back in those days. And it seems silly now, but it's just the way it was. So many people now have never had chicken pox, never known anybody with chicken pox because of the vaccines. But back then they didn't have that. So, and those of you who are my age will remember that they did not have that. And knowing that it was good when you were around somebody who had it so you could get it and be done with it. So the way things change, right, in the world. So I did get shingles, and I had some migraines, but that is not abnormal for me. Having migraines is something that I have dealt with off and on through my whole adult life. So I would say those two things were not something I would say were abnormal with my pregnancy at all. So then Isaac, it was time for me to go into labor. I went into labor. Isaac was born on his due date, 9 pounds, 1 ounce. He was cesarean. He was a big boy. He was cesarean, and because my first child had been cesarean, her labor and delivery was very difficult, and we'll talk about that when we talk about her another time. My labor and delivery with him was very straightforward. As soon as I started progressing, they went ahead and took me back and performed the surgery, and he was born. And he was happy, and his APGAR scores were good. So for those of you who are really into pregnancy and newborns and all of that, his APGAR scores were good. They couldn't get him to cry at first, but not because he couldn't, but because he just didn't. He just was not a crier. His whole demeanor was just so easy. He just didn't fuss. They tried, thump his feet and all the things and tried to upset him, and he squawked, but he didn't really cry. And it was just kind of who he was. That was indicative of who he would be as a person. And so he was super sweet, super happy, great baby, hardly ever fussed or cried, which, some babies are like that. Some babies are super fussy and some babies are just not. And he was one of those that wasn't. So that was pleasant. You hear such horror stories, and I wasn't sure, what would happen. You never are, right? You don't know until they're born. And so he was very sweet, very happy. He got to be walking and talking and right before he turned 2, about 10 days before he turned 2, he developed a brain infection. And at the time, we didn't know that's what it was. We thought he had the stomach flu. He started throwing up and was just nauseous all the time. Still sweet and lovey and happy, because that's who he was. Nothing bothered him ever. And so we thought he had the stomach flu, and then he started throwing up foam and blood. And if you've ever seen someone throw up blood, it looks like coffee grounds. So we knew that there was something wrong, because it had just been a little over a day and he was already that sick. So we took him into urgent care, and they said that he did just in fact have the stomach flu. They rehydrated him and they gave him Phenergan for nausea, and they sent us home. And they said, just, let him rest as much as he wants to, and, hopefully. And I said, well, he's throwing up foam and blood. That seems extreme for a stomach flu. I mean, I've had the stomach flu. At this point, I was in my late 20s. Like, I've had the stomach flu before. I know what the stomach flu is, and it seems odd that he's throwing up foam and blood. They said, sometimes that happens. Sometimes a person gets that sick, and just the constant heaving causes irritation. Thought it was unlikely, but said, okay, fair enough. So we took him home. He was no longer puking at that point. Okay, that one's not good. We're not going to use that one. And that one's not good either. I dug into them. I dug into them because I thought they had little wormholes, and I thought maybe if I dug far enough, but I think the worm might still be in both of those. So we're just going to leave those. That happens when you get apples from somebody's backyard and not from the store. When they go to the store, they always clean them up and check them out and make sure they don't have worms. And also, when they're commercially produced, there's so much pesticide put on them that they don't hardly ever have worms anyway. So if you're ever getting apples off of an apple tree out of somebody's backyard and you haven't done that before, know that there's probably going to be wormholes in a good chunk of your apples. So, and that you may have to dig those out. Anyway, I digress. So, we went home with him, and he was he was doing pretty well, and he was kind of lethargic, a little tired, but, to be expected when you don't feel well and you've been throwing up for 2 days. So, my phone is telling me something. Nothing important, apparently. So he did fine. The next day, he was throwing up again. And so clearly the medication they had given him had worn off. And he started to not look like he was feeling very well again, and more lethargic. So my ex-husband took him back. We still had Emma, and we didn't have anybody to watch her. So I stayed at home with her, and he took him to the urgent care again. We lived on post at the time, and there wasn't a hospital on post. There was just an urgent care and a clinic. And the local hospital was only a few minutes away. So if you had to go to the hospital, they would take you to the hospital, or you could go to the hospital in town. But it was in upstate New York, Fort Drum, for anybody who's military out there and knows what I'm talking about. So Fort Drum, New York is near Watertown, and Watertown Hospital is the closest hospital. So he took him back to the urgent care, and they again hydrated him and gave him, my son, of course, not my husband, and gave him some more anti-nausea and sent him home. And we're still thinking this seems odd that he's so sick for a stomach flu. and especially because of what had just happened with our older daughter. And I will explain all of that again when I do a video about her. So we were a little bit concerned about what might be going on. So he brought him home and he put him on our bed so that we could kind of keep an eye on him, because we were in military housing and our house wasn't very big, and I had put us in a front room that was, I think, designed to be a dining room, but anyway, that was our bedroom. So it was right there in the middle of the house. And we just were keeping an eye on him, but letting him sleep. And I went back to do laundry in the back room, and my ex-husband started shouting at me to like, come here. And I said, I'm putting a load of laundry in, give me just a second. It wasn't unusual for him to be slightly demanding about when he wanted something. So I said, give me just a minute, I'm putting laundry in, and he said, no, he said, come here. And I said, I'll be right there. And he shows up in the door of the laundry room, and he's holding Isaac like this, laid across him. And he said, and Isaac is in the middle of a seizure. So this was about 45 minutes after we had brought him back. And remember, he is like 10 days before he turned 2. So he's little, and he has him in his arms, and he's having a seizure, and his eyes are rolled back in his head, and he's foaming at the mouth, and it looked like something out of a horror movie. And so reasonably he was panicked. I stopped what I was doing, of course, and we got back in the car, and I drove like a mad woman. He got in the back with him and just held him, and I drove like a mad woman over to the urgent care. When I got there, he was, they took him back right away. And because I went through like the more emergent doors, because they did have an ambulance bay. So I drove in there so that we could be in kind of their more urgent area. And they took him in, and they tried to get the seizure stopped, and it wouldn't stop. And they decided that they gave him the full dose. So those of you who have never had an experience like this, with medications, emergent medications, there's only so much that they can give you, right? Dosing is dosing for a reason. There's only so much they can give you. So they had already exhausted in small doses the full amount that they could give a person his size. That's why they always weigh you. You think they just want to know how much you weigh? That's not why. It's because they need to know how much medicine to give you. So they had weighed him, of course, when we had been in over the last 2 days. So there was no need for them to weigh him again. They knew how much he weighed, and so they gave him what they could of this medication. So the seizure was not stopping. It was not even slowing down. It was just maintaining. And so they went ahead and put him in an ambulance. I followed the ambulance. My ex-husband was in the ambulance and took him to the local hospital there in Watertown. And you'll have to excuse my cat. It's 7 o'clock and he feels like he needs to eat right this minute. 7 a.m., 7 p.m. every single day he howls. So we got him to the hospital. They gave him more medication and more medication and more medication, to the point where he exhausted 3 different medications and was 2 doses of 3 into the 4th medication that they could give him before the seizure finally stopped. So by this point, you can imagine that this tiny little body is completely just racked. between the seizure and all of the medication, he was in a bad way. And he was essentially in a coma at that point, like a medically induced coma, because he had had so much anti-seizure medication. And anticonvulsants and anesthesia drugs are very similar. Some people actually use medications that they use in surgery for anesthesia to put you to sleep for treatment of their seizures. So that kind of gives you an idea of what kind of drugs we're talking about, right? So he was out. And they put him in another ambulance and they took him to Syracuse Hospital because that was the closest big hospital, and they had a children's hospital wing there at Syracuse Hospital, SUNY Hospital, for Syracuse University Hospital. So they put him in ICU, and he was in ICU for about 10 days while they treated him and tested him and did scan after scan and MRIs, and found that he in fact had this brain infection. So they showed us on the MRIs. Of course, at this point, we are in shock and disbelief, and we cannot even fathom what is happening. And we're intelligent humans, but there's a big difference between taking your kid to the doctor thinking that they have the stomach flu and them ending up in the hospital where you find out that they have an infection that is taking over a portion of their brain. So they did a whole bunch of testing. They had to send some of it off to the Mayo Clinic, and in the meantime they treated him both for bacterial and viral. And he ended up starting to get a little bit better. We spent his second birthday in the ICU, and we see, there it is. When we talk about wormholes, there's the little dark spots that have the wormholes in. So we'll just take those out. So I have my trash can right here, so that makes it really nice and easy. So we had his second birthday in the ICU, had cake and the whole bit. We had our youngest son at the time, and I have pictures of him, the nurse in the ICU holding him, eating cake with him because he was adorable, and how do you not? We didn't have our youngest baby yet, but our older daughter, who is the oldest of my currently 6 children, it was there, of course. And so there we were in the ICU having birthday, thinking that he would eventually recover and all would be well. But that this was just pretty stressful time. Altogether, he ended up spending about 2.5 months, almost 3 months, in the hospital. He was in the ICU for 10 days. They put him in a step-down unit for a couple of days. And when they put him in the step-down unit, he had another seizure, pretty big one. And they went ahead and put him back in the ICU, in isolation actually, because they didn't know why he was starting to have seizures again. And so then he was out, and all total he was upstairs for in the children's area for about 3 weeks, and then they moved him into rehab. And of course everybody loved him, because if you've ever been in a rehab section of the hospital, there's not a whole lot of kids there. So especially if it's a hospital that caters to both adults and children, most of the people in a rehab wing are older, that are recovering from strokes and injuries and things like that. Most of them are adults. And so he was a novelty, and boy did they love him. He's had beautiful eyes and long eyelashes and was super little and cute and chubby, and they just thought he was the cat's pajamas. So he ended up starting to recover, and we ended up bringing him home. Shortly thereafter, my ex-husband got a hardship discharge, and we ended up bringing him back to Colorado. So I told you before, we live in Colorado, and we came back to Colorado so that we were closer to family, because we knew that going through all of this was going to be difficult. There was some conversation. I did some research, and Houston at the time had a really good children's neurology presence. The Children's Hospital down there was known for their neurologists, and so I did express an interest in going there, but it was decided that we're coming back here to be with family. So, which turned out to be all right, but was not the choice that I would have made at the time. So we came back here, we got settled in, and we thought Isaac was getting better. He was starting to get back to being able to eat on his own. He had completely changed. The look of him was not the same. He was still pretty chill, still pretty relaxed, but you could tell that something had happened to him. He he had lost a lot of weight, and he wasn't really able to feed himself well, so we had to do a lot of spoon feeding and high caloric things like Boost and stuff like that could make him hopefully get in some calories fairly simply. So we were here for a few months and moved into our house and all of that, and he started doing this weird thing where his arm would just kind of shoot out to the side, and then it would relax, and then sometimes it would do it again over and over again, and we thought, well, that's strange. And so we ended up taking him to the doctor. Turns out he was having seizures, and they did a whole lot of testing and EEG and all of that, and found out that he overnight monitoring, weeks in the hospital. We by the time it was all said and done and we figured out what was going on, we had been in the hospital for a lot. And so we found out because of a brilliant epileptologist who I still love like he's my uncle. We spent a lot of time with him, and he did such great things for our family, and just was he was a wonderful resource, and was just really patient and kind and lovely with all that we were going through. And so I still appreciate him. So Dr. Laupersert, if you're out there and you see this, I still love you. So we found out that he was having in the neighborhood of 1,000 seizures a day, and Isaac, of course, not the doctor. And he, if you count that up, that's a seizure every couple of seconds. So he would be doing things like he would yawn, and it was actually a seizure, that sort of thing. Any little movement was pretty much related to seizure activity. And so they decided that he would be a good candidate for brain surgery. He had brain surgery when he was 3 years old. It was on April 16th. I still remember that day. And he came through the surgery really well. Everything went really well. They were able to, they did a right functional hemispherectomy is what they call it, where they took out his right temporal lobe because that's where the initial infection was. and it was basically useless brain tissue at that point. It had been so damaged that there was no recovering that. So they took out his right temporal lobe, and they severed the two hemispheres of his brain to prevent, because most of the seizures were coming from that right side. So they were trying to prevent the seizure activity from crossing into his left side and causing problems on the left side, in hopes that he would eventually recover. I'm just throwing apple everywhere, by the way. It just keeps bouncing off of me. So he came out of brain surgery. He looked like he had been beat up. His head was swollen, and he had black eyes, and he looked terrible. But we were so hopeful that he would recover, and that would be the thing that would help him. As you know, this is years later, and it's only been 2 years since he passed, so that's not the end of the story. But it's a good place to stop. We were in a happy place. He was in the hospital. He was recovering from his surgery. We were really hopeful that he was going to recover and that everything was going to be good. And so this is a happy place to end if you can only watch a video for a short time, because I've already been talking for almost 45 minutes, and I don't want to create videos that are too super long. So this is a good stopping place. I'm going to go ahead and stop the video. I will start it again. I'm going to keep doing apples. I'm going to keep talking about Isaac. So the next video will be a continuation of this video. But I want to make sure that if you are on a limited time frame, that you have enough time to stop the video and then start another one. Thank you for listening.